Occupational therapy practitioners are skilled in helping people with PTSD increase functional performance by addressing barriers to occupational performance. Post-traumatic stress disorder, PTSD, is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event, series of events, or set of circumstances. PTSD does not appear in everyone. However, according to the American Psychiatric Association, 1 in 11 people will be diagnosed with PTSD in their lifetime. Causes of PTSD can include childhood trauma, war, emotional, sexual, or physical abuse, a near-death experience, and/or witnessing a traumatic event. PTSD can be widespread. The tragic events of the 9/11 terrorist attacks in New York City, for example, scarred far more than just the NYC skyline. Even those who didn't lose loved ones in the attacks nevertheless witnessed horrific destruction, and the entire nation experienced an unprecedented loss of personal safety. In fact, according to ny.gov, PTSD is the most common health concern resulting from the 9/11 attacks. Symptoms of PTSD fall into 4 categories, and these symptoms can vary in severity. Intrusive thoughts such as repeated involuntary memories, distressing dreams, or flashbacks of the traumatic event. Flashbacks may be so vivid that people feel they are reliving or seeing the traumatic experience before their eyes. Avoidance of trauma reminders such as places, activities, objects, and situations that can trigger distressing memories. People may try to avoid remembering or thinking about the traumatic event and resist talking about what happened or how they feel about it. Alterations in cognition and mood can cause an inability to remember important aspects of the traumatic event. A traumatized person can also have negative thoughts and feelings about themselves or others and feel devoid of happiness. Alterations in arousal and reactivity, demonstrated by self-destructive, reckless behavior, difficulty sleeping or concentrating, and difficulty managing emotions. PTSD can cause secondary problems such as depression, substance abuse, and chronic pain. It can also adversely affect a person's ability to engage in current and future occupations by creating cognitive, social, and physical alterations to their baseline state. The person living with PTSD can exhibit maladaptive behaviors that hinder their social, physical, or mental participation in functional activities. Areas of impaired occupational performance include leisure activities, activities of daily living, social activities, educational activities, pre-vocational and vocational activities. Occupational therapy practitioners are skilled in helping people with PTSD increase functional performance by addressing barriers to occupational performance. As a part of a multidisciplinary team, occupational therapists can provide clients with age-appropriate, client-centered techniques and treatments. Evidence-based treatments for PTSD that a multidisciplinary team can use can include cognitive behavioral therapy, cognitive processing therapy, prolonged exposure, eye movement desensitization, reprocessing, accelerated resolution therapy. Occupational therapists can also help clients with PTSD by making recommendations to the physical or temporal environment, helping the client modify tasks, and helping them identify ways to increase their social circle. Occupational therapy interventions and recommendations can include assisting the client with locating local PTSD support groups, assisting the client with identifying activities that support a mind-body connection, and assisting the client with identifying activities that decrease anxiety, such as meditation, exercise, or leisure activity engagement. Pharmacology methods can be used to treat PTSD as well. Medications can address the chemical imbalance caused by the trauma. It can also be used to manage the secondary effects of PTSD, such as depression and anxiety. A multifaceted approach to care can improve client outcomes and help them return to occupational engagement. This approach not only considers the type of treatment and the type of provider, but also considers how the services are provided. A client with PTSD may benefit from service delivery options such as telehealth versus clinic-based care, or a hybrid model.